A very good morning to one and all. Dear aspirants, I am Mr. Prakash. Welcome back all of you to the important part of discussion on the pharmacology. There we are going to discuss some of the important MCQs from the pharmacology. As an aspirant, you must know that from the pharmacology where the questions may be extracted. Okay, so usually in the examination, as you have seen, the questions might be asked, especially from the pharmacology. They will choose some of the important drug of choice. Okay, sometime they will ask some of the important adverse effect on the drugs. Okay, some of the antidotes they are going to ask from the pharmacology. Okay, as well as some drugs are contraindicated in some of the important conditions, especially in the pregnant woman. Okay, those drugs may be teratogenic in nature. Okay, then those areas the question may come usually in the pharmacology. Okay, so considering these important points, I have taken some of the important MCQs on the discussion. Okay, so today we're going to have a wonderful discussion on the MCQ discussion. Okay, so from the first class, I have taken some of the important drugs. Okay, that are considered to be the first preferential drug. Okay, or the drug of choice in some important conditions. Okay, so now let us move on to the discussion on this MCQ. And usually means the main important MCQs I have taken from the drug of choice. Now let us start our discussion from the first MCQ. See the read out the MCQ. What is the drug of choice for treating swine flu? That is H1N1 influenza in the adult. Okay, that is your first MCQ. What is the question asked? Please kindly read out the question. Okay, what is the drug of choice? This is most commonly the question will come like this. Okay, from the pharmacology, so most of the time they will ask you the drug of choice or the first preferential drug to be given to some of the important clinical conditions. Okay, so the drug of choice in treating the swine flu. Okay, swine flu, that is known as an H1N1 influenza. Okay, so flu infection it is in the adult. Now let us see the the options available, that is amantadine, oseltamivir, zanamivir, and ribavirin. Ribavirin. So considering all the drugs, all that drugs are antiviral drugs. You can see how the antiviral drugs are identified. See all the drugs almost they're ending with the like vir or virin. Okay, so these drugs are usually considered as an antiviral drugs. So oseltamivir, Ranamavir and ribavirin, these are all antiviral drug. Amantadine, it is not an actually an antiviral drug. Okay, so this drug is most commonly used where this amantadine is generally used. It is used in the treatment of, yes, where it is been used commonly, Parkinson's disease. Okay, amantadine is used in the treatment of Parkinson's disease. Okay, and why this is considered, why it is given as one of the option, you see, even this amantadine is also having some antiviral properties in it. Okay, it can be used to treat the some of the viral infections. Okay, rather than though amantadine is a main drug of choice in the Parkinson's disease, it is also having an antiviral character, so hence it is considered. But is it a drug of choice for H1N1? No. Okay, this drug is most commonly used in the treatment of Parkinson's disease. Okay, and it is mainly used in maybe used in the treatment of influenza A virus, viral infection. Influenza A viral infections, this amantadine may be used. But now this drug has outdated, we're not using anymore, and the body has developed an resistance to this amantadine. Okay, has developed an resistance, hence this drug is not most commonly used, then it is not your choice of drug. It is not a choice of drug in the treatment of swine flu. Then consider the other drug. What is that? Oseltamivir. Yes, of course, it is an antiviral drug, and this drug is most oftenly or most commonly used in the treatment of. Okay, where it has been used? It is used in the treatment of flu infections. This drug is mainly used in the treatment of flu infection. Okay, yes, is H1N1 is a flu infection? Yes, of course, it is a swine flu. Swine flu, it is a flu infection. Yes, oseltamivir is considered as one of the important drug. Whether is the drug of choice, you will see other two options, then you will consider the answer. Okay, directly will not jump into the decision of taking any one option. Okay, let us see other two options. The another option is janamivir. Okay, so yes, of course, it is also a antiviral drug. It is also an antiviral drug, and it is also used in the treatment of flu infection. It is also used in the treatment of flu infection. Then is the drug of choice? Let us see. Okay, then the another drug is ribavirin. So what is the ribavirin? It is also a antiviral drug. Okay, so where it is most commonly used, that you must know. Okay, so this ribavirin is an antiviral drug used mainly in the treatment of chronic hepatitis C virus. Okay, it is used in the treatment of chronic hepatitis C virus, and it is also used in some conditions like an viral hemorrhagic fever. Viral hemorrhagic fever. Okay, so this ribavirin is not most commonly used in the treatment of flu infection. Now two options has been left. One is the oseltamivir, the another one is janamivir. Okay, so among that, which is considered to be the most common drug or the drug of choice, you see, so janamivir is also used in the treatment of flu, but the route of administration of this janamivir, you see, okay, so it is used through the nasal route. Okay, nasal route. Through the inhalation, this drug has been most commonly used. Okay, so as it is used through the nasal route, it is irritating to the patient, it is not convenient, it is not a preferred drug over the oseltamivir. Okay, both are, the janamivir is an alternate to the oseltamivir. If the oseltamivir is not available, okay, oseltamivir is having related contraindications or the side effect on the patient, then you can go for the second option, that is janamivir. But compared to the janamivir, oseltamivir is considered as the drug of choice in the treatment of all the flu infections, not only the swine flu, I'm saying. Okay, all the flu infections, the drug of choice will be the oseltamivir. Okay, by considering all this fact, then what we can see, what is the right answer for your question? Okay, the right answer will be the oseltamivir. Oseltamivir. Okay, so this we have to clinically, you have to evaluate all the options, then we have to go. If there is no option for the oseltamivir, okay, there is option for only the janamivir. Okay, then you can tick, or you can mark as a right to the janamivir, because it is an alternative drug in the treatment of flu infections, though it is given through the nasal route. If the patient is allergic to the oseltamivir, or the oseltamivir is not available, then you can use as the janamivir is the option. But here in this, the drug of choice in treating the swine flu will be the oseltamivir. Okay, so what is the drug of choice? The drug of choice for this swine flu will be the oseltamivir. Clear? Okay, so this is how we have to choose in a proper way. Okay, because see, you can see that most of three drugs are all the antiviral drugs. Okay, among that, which is considered to be the drug of choice. Some of the important points also you have to consider here regarding the oseltamivir. Maybe the question may twist you, or maybe ask you in the some other way. Okay, so what may be asked, you see, how this oseltamivir is going to act. Maybe the based on the mechanism of action, very less questions will come, but you can just keep in your mind. Okay, so this oseltamivir act mainly by blocking the by blocking the viral release from the cell. Viral release from the cell. Okay, is the one point to just keep in your mind. Then another point, when to start, this oseltamivir. Okay, so if it is, if you want to have a best action of the drug, okay, then we have to start as early as possible, within 48 hours of the infection. If you could find a infection, okay, then within 48 hours, then we have to start this oseltamivir. Very important thing. Okay, then what may be the dose? Okay, so the dose of the drug is about 75 milligram of the oseltamivir is given twice in a day. Twice in a day. BD doses can be given. Okay, one in the morning and one in the evening. Okay, and what is the course of this oseltamivir? Okay, what is the course of the oseltamivir? You see, so this oseltamivir can be given for 5 days. This can be given for 5 days to complete the course. To complete the course, the possible question from this oseltamivir I'm asking. Okay, because I think during the COVID pandemic, you might have seen that this oseltamivir has also been used in treating the like what, the coronavirus and other related viral infections. Oseltamivir also given as an prophylactically. Oseltamivir has been given in treating the viral infection during the COVID pandemic period. Okay, what we have given, oseltamivir 75 milligram twice in a day for a 5 days of course has been given. Okay, when it act best, when it is given within 48 hours of the infection or the symptoms has come, then this would, it will act better. And how it act, it blocking the viral release from the cell. By that way the oseltamivir is going to act. Okay, so this is the some important discussion on this first MCQ. Just let us have some glance on the antiviral drug. Okay, because repeatedly the question may come from this antiviral drug. Some important points I have considered, I have taken for the discussion. Okay, these drugs are classified mainly based upon that which virus the drug is going to act. Okay, some drugs which will act on the herpes virus. Okay, some drugs which act on the influenza virus. Okay, some drugs will act on the HIV virus. Some drugs will act on hepatitis virus, and some drug on COVID-19 or coronavirus. Okay, let us see the drug of choice in the herpes virus. Okay, if there is infection from the herpes virus, the drug of choice will be the, if the infection is by the herpes simplex, if the infection is by the herpes herpes simplex virus. Okay, then the drug of choice will be the acyclovir. The drug of choice will be the acyclovir. Okay, then if the infection is by the varicella zoster, if the infection is by the varicella zoster, okay, there also the drug of choice will be the acyclovir. You consider, usually most of the time the herpes infection is treated by acyclovir. Acyclovir is the drug of choice in herpes virus. If there is an infection by the cytomegalovirus, okay, CMV, what generally we can call, there the drug of choice will be the what, ganciclovir. Okay, the drug of choice will be the ganciclovir is the drug of choice in infection which is caused by cytomegalovirus. Cytomegalovirus. Okay, next, if the infection is by the influenza, okay, just what we have seen, just in the above MCQ discussion, what we have seen, if any infection by the influenza virus, either it is a influenza A or the influenza B, okay, then what is the drug of choice? Just now I have discussed, that is the oseltamivir is the drug of choice in treating all the flu infections or the influenza infections. Very important is the HIV. Okay, so HIV will be treated with the many group of antiviral drugs, that would generally what we can call as an ART, antiretroviral therapy. Okay, what is that? ART therapy has been given in the treatment of HIV. Okay, maybe for the exam point of view, the important point I will consider, what may be the first line regimen for treating the HIV infection now. First regimen, what is considered, or which drug is considered to be the most important regimen in treating the HIV infection right now? Okay, so that includes the combination of three drugs, that is called as a triple therapy. Okay, first line treatment for the HIV will be by the three antiviral drugs. So which are all those that generally considered as an TLD triple therapy? TLD triple therapy. Okay, so what it refers to? The T refers to tenofovir. Okay, the L refers to lamivudine, and the D refers to dolutegravir. Dolutegravir is the another drug. Okay, so the first line regimen in treating the HIV infection or the triple therapy. What we can call it is called as a triple therapy. Triple therapy. It is going to act best in treating the HIV infections. Tenofovir, lamivudine, and dolutegravir are the three important drugs that is generally considered as an TLD therapy. Please keep in your mind, and you can mark it as an important. You can mark this as an important one because the question may directly come from this HIV infection. Then the hepatitis is also one of the a viral infection. Okay, what is the drug of choice in treating the hepatitis C? Okay, this hepatitis most commonly you will see as an hepatitis B, okay, and hepatitis C. So what is the drug of choice for the hepatitis B? Okay, for the hepatitis B, the drug of choice will be the tenofovir. Tenofovir. You can consider B for BT. Okay, if there is an hepatitis B virus, the drug of choice will be the tenofovir. Tenofovir. Okay, then if there is an hepatitis C, okay, there will have the drug of choice. Okay, there is a two drugs will be commonly used in combination that are soposbuvir and ledipasavir. Okay, ledipasavir. C CLS, you can remember by this way, CLS. Okay, hepatitis B in you can remember that in terms of an BT. B refers to the hepatitis B and T refers to the tenofovir, where hepatitis C will be treated by two combination of drugs. Okay, that is one is soposbuvir and another one is ledipasvir. Ledipasvir are the two combination of drugs can be used in the treatment of hepatitis. This is also considered you can import as an important point because in the COVID pandemic, the most commonly we have been used. Okay, is a recent um, a viral disease what we have seen. Okay, so what may be the drug of choice in the COVID-19 or the coronavirus you see? Okay, so the drug of choice what we have used as a drug of choice is the remdesivir. Okay, remdesivir is considered as the one of the important drug of choice in treating COVID-19 infection or the coronavirus infection. Okay, so please remember all of these are important only. Okay, if there is an influenza virus, okay, the drug of choice will be the oseltamivir. If there is an herpes virus, most of the drug of choice will be the acyclovir. If there is an cytomegalovirus, that you have to remember. Okay, ganciclovir is the drug of choice. Then for the HIV, triple therapy is the first line regimen. For the hepatitis, okay, for the hepatitis B is separate and hepatitis C is separate, and for the COVID-19, it is remdesivir. Most commonly, the questions from the antiviral drug comes are the adverse effect because most of the antiviral drugs are associated with some of the important adverse effect. Okay, so that also I have included in this discussion. Okay, see, now let us see the important adverse effect of the drug. Acyclovir is one of the important antiviral drug in treating the herpes virus. Okay, so this acyclovir is always associated with some of the important side effects such as nephrotoxicity. This drug is going to cause nephrotoxicity because it is going to form the crystalluria. It is going to cause the crystalluria. Acyclovir is going to cause the crystalluria. Then it is also going to cause the neurotoxicity as well. It is also going to cause neurotoxicity. Acyclovir is going to cause the nephrotoxicity as well as neurotoxicity. Keep in your mind. Important part of discussion. Then ganciclovir is the drug of choice in treating cytomegalovirus. Just now we have seen. Okay, so very important adverse effect of these drugs. You know that some of the important adverse effect of the antiviral drug, some drugs are going to cause the bone marrow suppression. Okay, that is going to cause the bone marrow suppression. Among that, the most important drug will be the ganciclovir. Among that, the most important drug will be the ganciclovir. Hence, this is this one you consider as an important adverse effect of the drug. Now it is considered as one of the important MCQ favorite question. Okay, so which antiviral drug is going to cause the bone marrow suppression? You see, ganciclovir is the first line. Okay, that is the very important drug which is going to cause the bone marrow suppression. Other than that, other drugs are also going to cause, but the most important drug which is going to cause bone marrow suppression will be the ganciclovir. Then there is another class of drug, that is foscarnet, is also one of the antiviral drug. Okay, so this drug is also going to cause the nephrotoxicity, okay, and which is also going to cause the electrolyte imbalance, where it makes the poor absorption of the calcium or excessive excretion of the calcium and the magnesium. This foscarnet is going to cause nephrotoxicity as well as electrolyte imbalance. Oseltamivir, just we have seen. Okay, now this oseltamivir is the drug of choice for flu infections. Okay, so this is having a minimal side effect such as nausea and vomiting. Juduvedin, you might have heard about this drug. Okay, it's one of the important drug to be given to a pregnant woman in order to prevent the what um, a mother to child transmission. Okay, so juduvedin is one of the important drug. Okay, so this juduvedin is going to cause some of the important adverse effects such as anemia. It is going to cause, which is going to cause the anemia, and even this juduvedin is also going to cause the bone marrow suppression. It is also going to cause the bone marrow suppression. One we have seen is the ganciclovir, the another one is the juduvedin is going to cause bone marrow suppression. Tenofovir is one of the important antiviral drug were used in the treatment of HIV infection. Okay, this tenofovir is going to cause the adverse effects such as nephrotoxicity, and also which is going to cause the bone loss, which prevents the uh, what development of osteocytes. Okay, the bone cells, the development of the bone cells itself is inhibited, when which is going to cause the bone loss. Okay, so these are other drugs are not so important. We'll just move on to this. So suppose bovir, Soposopovir is the another drug. Okay, so which is also having a minimal side effects such as fatigue and headache. And the important drug, you see, the remdesivir, which has been used most commonly in the COVID-19 infection. Okay, so this drug is going to cause the hepatotoxicity. This drug is toxic to the liver, and which is going to cause the hepatotoxicity. Okay, so important questions also comes from this adverse effect on the antiviral drug. Please remember. Okay, so some of the important adverse effect are, one is most of the drugs are nephrotoxic in nature. Okay, so some drugs is going to cause the bone marrow depression. So what bone marrow depression, which is going to cause. Okay, and some drugs are hepatotoxic as well as neurotoxic as well. Okay, nausea, vomiting, fatigue. Okay, these are all most common side effect of the antiviral drugs. Some of the important point to be remember in this antiviral drugs, you see, whenever you give an acyclovir, okay, it requires a special enzyme for its activation. Okay, so that is thymidine kinase is the one of the important enzyme to be required for the activation of this acyclovir drug. Then at another drug we have included, that is ganciclovir is the drug. Okay, is the drug of choice for cytomegalovirus. Along with that, very important point to remember about this ganciclovir is that this is the drug most commonly cause the bone marrow suppression. Then what I told, the sultamivir to be started how early? That to be started within 48 hours of this infection. Then we have included one more important drug, that is the juduvedin, a most common antiviral drug used in the pregnant woman. Okay, so what it causes? It mainly prevent mother to child transmission. mother to child transmission is usually prevented by jodibidine. Other drugs are also there. Okay, so jodibidine is used most commonly in preventing mother to child transmission. Then tenofovir we have used. It is also one of the important antiviral drug used in the treatment of HIV. Okay, so it is important drug in the treatment of HIV, and also it is one of the important drug in treating hepatitis B infection as well. Hepatitis B infection as well. Just now I have included one more drug, that is soposbuvir. Okay. So what is important about this drug? You see, this drug is considered to be one of the important drug in treating hepatitis C infection. Hepatitis C infection, that is the backbone of HCV therapy. HCV therapy. Some antiviral drugs such as protease inhibitors, mainly which cause the protease inhibitors, are mainly going to cause the metabolic syndrome. Metabolic syndrome. And this remdesivir is generally used. Where it has been used? It has been used mainly in the COVID time. That too, the hospitalized sick patients only considered to be taken to use the remdesivir, used in the hospitalized COVID-19 patients. If it is not possible to remember all the antiviral drugs, you remember this. What remember? What to remember? These four drugs you have to remember. Goat drugs, what you can call. Okay. How to remember? You just think goat hits the virus. Goat hits the virus. Okay. So what is meant by that? Goats, you see, where the G refers to ganciclovir. It is a drug of choice in treating cytomegalovirus, and it is also going to cause bone marrow suppression. Very important drug to remember. O refers to the oseltamivir, used in all the influenza viral infections. Then acyclovir. Acyclovir is the drug of choice. Where acyclovir is the drug of choice in herpes simplex or herpes infection, herpes viral infection. Okay, so acyclovir is the drug of choice. For the influenza, oseltamivir is the drug of choice, where acyclovir is the drug of choice in herpes virus. Then the tenofovir is the drug of choice, in hepatitis B as well as HIV infection. It is a drug of choice in hepatitis as well as HIV infection. Oseltamivir is the drug of choice in influenza. This is for important, very important. I can mark here as a very important point to be remember for the exam point of view. Okay. Goat hits virus. Four important drug you remember. Most commonly the question will come from these four important drugs. Okay. As I told that you just remember some of the important toxicity. Okay. I repeatedly am keep on telling on this. Okay. These antiviral drugs are going to cause the bone marrow suppression. Among that, the most important drug will be the ganciclovir is the important drug which is used in the treatment of cytomegalovirus. Okay, so which is going to cause the bone marrow suppression. Please keep remember. Then acyclovir is going to cause the nephrotoxicity. Is toxic to the kidney, and carefully you have to use it in the patient with the kidney disease. And jodibidine, which is used in the pregnant woman, is usually causes the anemia. Why? Because you see, it is mainly like uh, involving in the what disturbing the metabolism of the folate. Okay, so where the new RBC cells has not been formed, and which is resulting into the anemia. Okay, so whenever you are giving a patient, a pregnant woman, a HIV pregnant woman, you are giving a jodibidine, then always you have to supplement, additional supplementation of folic acid and iron will be given to that pregnant woman. Okay, so these are the some important points you have to remember with the antiviral drugs. Okay, as the class has not included these antiviral drugs, I have included some important glance point on this antiviral drugs. Clear? If it is clear, then we will just move on to the second MCQ. See the second MCQ, read out carefully. What is the primary choice for treating cholera in adult? Okay, cholera in adult. What is the important question? What is the primary choice for treating? They are not asked about the primary drug of choice. What is the primary choice of treatment in treating the cholera? Okay, so you know that cholera is called by a vibrio cholerae. Okay, what is it characterized by? It is mainly characterized by a loose watery diarrhea is the very important character of the cholera. Okay, so what happens with the cholera? So where the patient is manifested with the severe watery stool, okay, there is a loss of fluid, loss of electrolyte, okay, the patient looks dehydrated, okay, and other symptoms might be developed, even nausea, vomiting will also be there associated with the cholera. Then what is the primary choice of treating the cholera? Ciprofloxacin is one of the antibiotic. Second option will be the ORS, oral rehydration solution. Third is the azithromycin. The fourth one is the tetracycline. They were given three important and antimicrobial agents, and there is one therapy, that is oral rehydration solution. So what is important? What is most important in treating the cholera? Yes, just now I have told, okay, cholera is manifested with the severe or more frequent, more watery stool. Patient will be manifested with the severe dehydration, loss of water, loss of electrolyte. Okay, then what is your prime, as the nurse or as a medical professional, okay, what is most important? The most important choice in treating any dehydration will be the rehydration. Okay, antibiotics will be given, of course, okay, in order to treat the what, in order to treat the any bacterial or viral or any infections, okay, the antibiotics or the antimicrobial or antiviral drugs will be given. But other than that, very important concern is that treating the most severe manifestations. Okay, so cholera, where the patient will be having a severe dehydration, loss of water and electrolyte, okay, then the first and foremost or the primary choice in the treatment of this cholera will be the, we have to rehydrate the patient first. We have to rehydrate the patient with oral rehydration solution. Oral rehydration solution is considered to be the most important part of treating the cholera. That is the primary treatment in the treatment of cholera. Okay, then ciprofloxacin can be given. Is ciprofloxacin can be given, azithromycin can be given, tetracycline can be given, you see. Okay, so yes, of course we are going to give these drugs, okay, these drugs in order to reduce the severity of the infection. Okay, reduce the severity of the infection. Ciprofloxacin can also be given, azithromycin can also be used, as well as the tetracycline is also been used. Okay, what is important in this, you see, so all these drugs are going to act against the infection, but very important thing is that you have to correct the dehydration. If the patient is not corrected with the dehydration, okay, then that result in a very bad way, even the patient may die because of this. Okay, so very most our primary choice of the treatment of the cholera will be the rehydration, that is by the oral rehydration solution. Either you can give through the IV, if patient is severely dehydrated, even he is not tolerating the oral, okay, then you can go for IV bolus infusions, that you correct the dehydration. Okay, so correcting dehydration is one of the important treatment in this cholera. Okay, clear? Okay, so these antibiotics can also be used, but these are just going to reduce the duration of infection, rather it is not going to treat the immediate effect of the cholera. Then the third MCQ is, what is the drug of choice for managing cardiogenic shock in the intensive care? Very, very important. Okay. So when we were discussing about the cardiovascular drugs, okay, we have discussed about this. What is the drug of choice in managing the cardiogenic shock in the intensive care unit? Let us see carefully, read out the options. Okay, first one is the epinephrine, dobutamine, norepinephrine, and dopamine. Let us see one by one. Okay, epinephrine can be seen. Where the epinephrine can be used? Epinephrine is used as, is it used in the cardiogenic shock? Might be, but not the primary drug. Might be, but not the primary drug. But mainly where it is used? Mainly it is used as a drug of choice in cardiac arrest, cardiac arrest, and Mainly it is used as a drug of choice in the anaphylaxis reaction of the drug. Epinephrine is the drug of choice in treating the cardiac arrest, okay, or in the treatment of any drug anaphylaxis or any anaphylactic reactions. So then, whether does the epinephrine is going to treat the cardiogenic shock? Maybe, but not effectively. Let us see the other choice of drug. Dobutamine. Is the dobutamine is the drug of choice? Yes, it is the drug of choice in treating the cardiogenic shock. What happens with the cardiogenic shock where the heart is unable to pump effectively, okay, where the output of the heart will be very less, okay, that resulting into a shock. What we requires, we have to improve the cardiac function. We have to improve the cardiac function. Hence dobutamine helps in the in improving the cardiac output. Okay, now see the other options, then we will finalize the answer. Norepinephrine. Norepinephrine is also been used, okay, it is one of the vasopressor. This drug is one of the vasopressor. It is going to cause the vasoconstriction, okay, where by constricting the blood vessels at the periphery may improve the return, okay, may improve the blood flow back to the heart. But does it helps in the proper functioning of the heart? That we have to see, okay. So it is used mainly in the treatment of hypotension. When the cardiac condition is good, okay, heart is able to contract enough, okay, then this drug is used in the treatment of hypotension. In the treatment of hypotension, as it is a norepinephrine is a vasopressor, rather it is directly not act on the myocardial muscles or myocardial tissues, okay. So it will helps on the blood vessels which cause the vasoconstriction and helps to improve or treat the hypotension rather than treating the cardiogenic shock. Maybe used as an adjunctive drug or supportive drug in the treating, but it is not the drug of choice. Then what about the dopamine? Dopamine is also been used as a drug, but again it is not a drug of choice because this dopamine is associated with important side effects. Okay, important side effects are associated with the um, along with the dopamine, and it is not a choice of drug in intensive care unit whenever you are managing a patient with the cardiogenic shock. Then what may be the right answer? Epinephrine, no, it is not a drug of choice in the cardiogenic shock. Dobutamine, yes, it is a drug of choice. Norepinephrine is the drug of choice in treating the hypertension rather than the cardiogenic shock. Then dopamine is there, but it is not a good drug over the dopamine, sorry, over the dobutamine, okay. So what may be the answer? Your right answer will be the dobutamine, because the dobutamine is considered to be the drug of choice in treating the cardiogenic shock. So what the dobutamine does? Okay, what the dobutamine does, you see, this drug is having a effect of inotropic effect on the heart, which cause the effective cardiac contractions, okay. It act on the myocardial cells and it helps in the proper functioning of the myocardial tissue and it cause proper cardiac contractility, okay. By doing a proper cardiac contractility, it helps in the a proper cardiac output and effectively treat the cardiogenic shock, okay. So dobutamine is having an inotropic effect. What it does, it is going to increase the cardiac output. What it does, it is going to improve the cardiac output without causing, very important thing is that without causing, causing vasoconstriction. Vasoconstriction. Hence, this dobutamine is considered as the drug of choice in treating the cardiogenic shock. It is, if it is causing a vasoconstriction, okay, again there may be a chance of increase in the blood pressure, increase in the blood pressure as well. But we need not to improve the blood pressure here, okay. Just we have to treat this cardiogenic shock. We have to improve the cardiac output rather than the heart rate, okay. So what we have to do, we have to have an inotropic effect on the heart. So this dobutamine is having an inotropic effect which improves the cardiac output without causing any vasoconstriction, okay. And some other important point to remember about the dobutamine may be asked in the examination. Okay, so where this drug is commonly used? So this drug is commonly used for cardiogenic shock. Okay, especially this cardiogenic shock after, okay, after acute myocardial infarction. Acute myocardial infarction. If this cardiogenic shock is after the myocardial infection, now this is the drug of choice, because after myocardial infarction, the contractile capacity of the heart has been reduced because of this that infarction. Okay, then this dobutamine helps to have an inotropic effect on that cell, cause the proper contractility. Then what may be the dose of this dobutamine can be given for treating this cardiogenic shock, you see? So this drug can be used in the doses of 2 to 20 microgram per kg per minute. Okay, per minute. On this doses, this drug can be used in treating cardiogenic shock. What is the major action of this dobutamine? It increases the contractility mainly. It increases the contractility. Okay, some amount of the heart rate, and mainly it is going to increase the cardiac output. Mainly increases the cardiac output by increasing the heart rate as well, not the pressure. But this dobutamine you have to use carefully. This dobutamine you have to use carefully, because there is a risk associated with this dobutamine. There is a risk associated with the dobutamine. Okay, so what it may cause? Yes, it is not going to cause the vasoconstriction. Okay, yes, it is not going to cause the vasoconstriction. Sometimes there is a possibility of developing the hypertension. There is a possibility of developing the hypertension. Okay, and also sometimes there is a possibility of developing the arrhythmias as well. Arrhythmias as well. Hence, this drug is to be carefully used. Carefully used. Clear? Okay, so use of the epinephrine, that we will see in the other MCQ, because a very important drug in the treatment of anaphylaxis. Okay, whenever the patient comes the history of some cardiac arrest or severe anaphylactic reactions. Okay, so now that is the drug of choice. Here, this is the drug of choice in anaphylaxis. Clear? Okay, so dobutamine is one of the important drug in treating the cardiogenic shock in the ICUs, not the dopamine. Okay, because as I told that dopamine is having some of the important adverse effect. Okay, which may cause the arrhythmias. Okay, mainly this drug is going to cause the arrhythmias. The mortality is increases with this dopamine. Let me include about some of the important point about the dopamine. So, dopamine, why the dopamine is not a most common drug or the drug of choice in treating cardiogenic shock, you see? Mainly it increases the risk of mortality, particularly after the acute myocardial infarction. If you are using this, okay, it increases the mortality. It increases the arrhythmias. Okay, and also it sometimes cause the tachycardia. It is going to cause the tachycardia. Hence, now dopamine is not a choice of drug, not a good choice of drug. Good choice of drug. Okay, well, now let us move on to the MCQ4. Okay, well, see, read the MCQ carefully. What is the immediate drug of choice for anaphylactic shock? Carefully read. Okay, what is the drug of choice in anaphylactic shock? Very important and most frequently asked question from the pharmacology. Okay, see, let us see the options available. Okay, one is the corticosteroids, antihistamines, epinephrine, and salbutamol. You know, immediately after any anaphylactic reaction or any drug reactions, okay, so immediately the doctor has been advised to give hydrocortisone, maybe they will advise to give the avil also. Okay, and sometimes if the patient is having a severe respiratory what respiratory difficulties, okay, there is an what bronchial edema, something we have seen. Okay, there even the doctor is going to advise to give the salbutamol. But what is the drug of choice? Corticosteroids can be used in the anaphylactic reaction. Yes, even the corticosteroids can also be used. What about the antihistamine can be used? Yes, you can use the antihistamines also in the anaphylactic shock. Okay, then is the epinephrine can be used? Yes, of course the epinephrine is also been used. What about the salbutamol? Yes, salbutamol can also be used. All of these drugs can be used in the anaphylactic reaction or anaphylactic shock. Okay, but what is the choice of drug? What is the choice of drug, you see? Okay, just now as I have been told, corticosteroids, what it does, corticosteroids are used in the treatment of anaphylactic shock, but it is not going to reverse the anaphylactic reaction. These corticosteroids are not going to reverse, rather than it is going to manage, or it is going to treat the what secondary reactions, secondary reactions which has been developed because of this anaphylactic shock. Secondary reactions, okay, like the what the patient has developed that flushing of the skin. Okay, maybe that is going to cause the vasodilatation. Okay, maybe the skin reactions are huge rashes which has been noted. Okay, so that kind of the secondary reactions from the anaphylactic shock has been treated with the corticosteroids. Even the antihistamines, mainly the antihistamines are going to treat the skin reactions. Okay, that such as the rashes, okay, the hues which has been developed from the anaphylactic reaction, so that will be treated with the antihistamines. Salbutamol, you see, salbutamol is mainly what it causes, which is going to reduce the either the laryngeal or bronchial edema. Bronchial edema is being reduced by this salbutamol, which is mainly going to reduce the respiratory symptoms, respiratory symptoms. Okay, rather it is not directly reduce the anaphylactic reaction. Anaphylactic reaction. Okay, corticosteroids, antihistamines, and salbutamol are the a supportive treatment for treating the anaphylactic reaction. But the choice of the drug, you see, the drug of choice will be the drug of choice will be the epinephrine, or what generally we can call as what is it is also called as adrenaline. Adrenaline is considered to be the drug of choice. Very very important, I can mark here. Okay, very, I will mark here. Okay, very very important question for your any competitive exams, any competitive exams. Okay, so what is the drug of choice? Adrenaline or epinephrine is considered as the drug of choice in treating the anaphylactic shock. Okay, anaphylactic shock, it directly reverses the process of anaphylaxis in the body. Okay, and it reduces the anaphylactic shock. So what possible other questions may come from this adrenaline, you will see. Okay, epinephrine, epinephrine, it is also called as an adrenaline also. It is also called as an adrenaline. Yes, it is the most important drug of choice in treating the anaphylactic reaction. What other possible questions may come from this using? What is the route of administration? If any patient in the hospital setup or in the casualty or in the ward setup, okay, found that the patient has developed an anaphylactic reaction, okay, that may be due to the any drug. Okay, so what is the route of administration? How will you administer this adrenaline? Route of administration, you see, okay, the most common route of administration of this adrenaline or epinephrine as an anti-anaphylactic drug is the intramuscular. Okay, it is not an IV, it is not oral, it is not any other route, subcutaneous or something. Okay, so this drug is given as an intramuscularly. This drug is given intramuscularly. intramuscularly. Then, where to give? What is the site of administration of the drug? If it is given intramuscularly, whether it is given deltoid or it is given gluteal, okay. So, what is the site of drug administration? You see, so this drug is given. The most common site of administering the drug is anterolateral aspects of the thigh, aspects of thigh. Okay, so this is called as an vestus lateralis. Vestus lateralis. Please keep remember this. It's a very very important drug. Okay, most commonly even the question may come from this area. Okay, what is the route of administration of epinephrine as an anti-anaphylactic drug? Intramuscularly can be given in the anterior lateral aspect of the thigh or the vestus lateralis. Okay, and you see the dosage of the drug. Okay, what is the dose? How much to give? Okay, how much to give? The dose for the adult is different, and the dose for the child is different. The dose for the child is different. What is the dose for the adult? You see, okay. So adult dose will be the 0.5 milligram of the drug given intramuscularly. Okay. So how much? What is the available doses of the adrenaline? You see, the adrenaline is taken in such a concentration that is 1 is to 1000. 1 is to 1000 concentration of the adrenaline is taken. Okay, so out of that, how much to be administered? 0.5 milligram intramuscularly the drug has been given. Okay, so if it is a 1 is to 1000, then what is the dosage? You see, okay, 1 milligram of the drug is available for each ml of adrenaline. If you take a 1 ml of adrenaline, okay, so approximately how much it contains? It contains about 1 milligram of the adrenaline. 1 milligram of the adrenaline. But how much to give? We have to give only 0.5 milligram. 0.5 milligram, it means that 0.5 ml of the drug has been given. 0.5 ml. What is the dose of adrenaline to be given? 0.5 ml of adrenaline given as an drug for anaphylactic shock. Anaphylactic shock. 0.5 ml intramuscularly into the vestus lateralis or anterior lateral aspect of the thigh, not to the gluteal, not to the deltoid region. For the pediatric group, the dosage of the drug you see, okay, the dose is about 0.01 milligram per kg. Per kg. Okay, so if the child is weighing 10 kg, 0.1 milligram or 0.1 ml intramuscularly it is given. Okay, 0.1 milligram. Okay, so example just I would like to take. Okay, child weighs about 10 kg. Okay, so what is the dose? If the child weighs about the 10 kg weight, okay, then ultimately the dose will be 0.1 milligram. Okay, 0.1 milligram per kg, like that to be given. Okay, sorry, per kg already have taken. So for this we have to give 0.1 milligram. If you want to take 0.1 milligram in the quantity, if you want to calculate, okay, so how much? Either 0.1 ml. 0.1 ml given intramuscularly. Given intramuscularly to the lateral aspect of the thigh. Clear? Very very important point. Okay, I can mark here as a very very important point. Any of this way the question may ask you. Suppose if after giving a single dose of this adrenaline for the anaphylaxis, if the symptoms has not reversed, okay, condition of the patient has not improved, okay, then you can repeat the dose. Repeat dose. Repeat the dose of this adrenaline. When to repeat? Once the first dose has been given now, okay, for every may repeat the dose. Repeat the dose for every 5 to 15 minutes. For every 5 to 15 minutes you can repeat the dose if the symptoms are not relieved or if the patient is getting worse. If the patient is keep on going worse, then you can repeat the dose for every 5 to 15 minutes until the patient has to come back out of that anaphylactic reaction. Anaphylactic reaction. Okay, so very important MCQ from this drug of choice. Epinephrine or adrenaline is considered as the drug of choice for anaphylactic reactions. Hopefully it is clear. Now we'll move on to the MCQ number 5. See, what is the drug of choice for acute angina pectoris? What is the drug of choice? Okay, drug of choice for what? It is acute angina pectoris. You have angina pectoris of two type, acute and chronic angina pectoris. Okay, here the question asked is, please carefully see. Okay, carefully see the drug of choice for acute angina pectoris. Okay, before that you should know the knowledge about angina pectoris. Okay, what is meant by angina pectoris, what is meant by acute, what is meant by chronic, then you can choose the drug of choice. Now see the options available: aspirin, nitroglycerin, beta blockers, and statins. Okay, what is the drug of choice? Whether the aspirin been used as a drug of choice for acute angina, is that aspirin does relieve the pain. What is the action of the aspirin? Where the aspirin is not generally used? Yes, where the aspirin is generally used, the aspirin is used as a drug for what? Aspirin is having an antiplatelet effect. It is going to prevent the clot formation. Okay, it is going to prevent the platelet aggregation. What this drug is used? It is used as an preventive drug. Preventive drug. What it does? It does the platelet, prevents the, it prevent the platelet aggregation. Platelet aggregation. Okay, so if it is, what happens to the angina pectoris? If there is a lack of blood supply to the myocardial tissue, okay, then the patient started feeling the acute pain, anginic pain. Okay, whether that a lack of blood supply is because of the if clot formation or platelet aggregation, that you have to see. Okay, then you have to choose. Aspirin can be given, it is a preventive drug. No, then it cannot be a drug of choice in relieving the pain. Aspirin is not going to relieve the anginal pain. Okay, rather it is going to prevent the platelet aggregation. Nitroglycerin, what it does, what you have to be done to treat the acute angina? Okay, you have to improve the blood circulation, you have to supply the oxygen to the myocardial tissue, then the anginal pain is going to be relieved. Okay, then what you have to do? You have to dilate the coronary blood vessels. Okay, then what the nitroglycerin does? Yes, it does, it does the work. What it does? It helps to dilate the coronary vessels. By dilating the coronary vessels, improves the blood circulation, improves the oxygen supply, then it relieves the pain. It relieves the pain. What about the beta blocker? Beta blocker can be used, beta blocker can be used in the treatment of other cardiac conditions. Okay, does it relieve the anginal pain? Probably your answer might be yes or no. Okay, it is not directly related to the acute um, angina pectoris. Okay, statins, statins are also used for the preventive purpose. It is also used for the preventive purpose. Then what may be the first choice of drug? Whenever the patient complains that there is a pain, acute anginal pain, okay, for acute anginal pain you can use the nitroglycerin as the drug of choice. Okay, so what to be done in acute case? We have to improve the blood circulation. Okay, we have to dilate the coronary blood vessels, improve the blood supply, improve the oxygen supply, then the pain is going to be reduced. Then your answer will be the nitroglycerin. Nitroglycerin does, because it dilates the blood vessels, it is a vasodilator and helps to relieve the anginal pain associated with the lack of oxygen supply to the myocardial tissue. Beta blocker can be used, okay, but rather what it does, uh, it is used in case of chronic cases. Okay, it can be used in the chronic cases rather than using in the acute cases, okay, rather than it is used in the acute cases. Okay, so aspirin is used as a preventive drug. Statin is also used in the as a preventive measure rather than in the active management of the what, angina pectoris. Please remember, if the question has come, okay, what is the drug of choice in treating the chronic angina pectoris? Okay, the drug of choice will be the chronic angina. Okay, now the same question, what is the drug of choice for a chronic angina pectoris? If there is a question instead of acute, if there is a chronic angina, then your answer will be beta blocker. Your answer will be beta blocker. Okay, but here the question has asked is the acute angina pectoris, then your answer will be the nitroglycerin. And beta blocker is used in the chronic angina pectoris. Chronic angina pectoris. Please remember, the question may come in such a way. Okay, in such a way. How it is going to reduce this? You see, okay, these beta blockers, how it is going to reduce the pain? You see, it is going to reduce the blood pressure. First, it is going to reduce the heart rate. Okay, it is going to reduce the blood pressure. It's going to reduce the contractility. Okay, contractility of the heart. By reducing all of this, it reduces the oxygen demand also, O2 demand also. Okay, by reducing the O2 demand, then it is going to reduce the chronic anginal pain. Chronic anginal pain. Okay, so this is how this is used as a drug of choice. If you come to the aspirin, as I told, it is a very important drug in the prophylaxis of the MI. Okay, prophylaxis of the MI, that you will see in the other MCQ. Okay, clear? I think aspirin MCQ is there. We will move on to the sixth MCQ. Okay, so that is the primary. What is the primary drug for prophylaxis of MI in high risk patient? High risk patient in the sense, the patient who is already having a hypertensive conditions, is a diabetic, is a obese. Okay, so, age related patients. Okay, elderly people. Okay, the patient's cholesterol level is high. Okay, so those patients are at a highest risk of developing the myocardial infarction. For them, what is the primary drug for prophylaxis of a myocardial infarction? Our question is the drug for prophylaxis, not the treatment. Okay, you know the difference between the prophylaxis and the treatment. Okay, so prophylaxis is an early management where you are going to prevent the possible risk associated with that particular condition. Okay, so what is the primary drug for prophylaxis of myocardial infarction in a high risk patient? So what to be done? What is the important reason for the myocardial infarction? What happens with the myocardial infarction? It is a condition where there is a decreased oxygen supply to the myocardial cells or the tissues. Okay, it is mainly because of what reason? Think it is one of the a coronary artery. Okay, so where there is a development of some plaque or atherosclerosis. Okay, there is a plaque or atherosclerosis has been developed here. Okay, and it is slowly decreases the diameter of the blood flow. Okay, and there is a poor blood flow to the myocardium. Okay, and that resulting into infarction at the later. Okay, so what we have to do prophylactically, we have to prevent this myocardial infarction. So what is the drug of choice? Read out the options carefully. Okay, clopidogrel, aspirin, warfarin, and heparin. Clopidogrel is one of the drug. Okay, where it has been used, where it is used, it is also used in the prophylaxis of the clopidogrel is also used in the immediate prophylaxis of the myocardial infarction. Aspirin, yes, it is also used in the prophylaxis of the myocardial infarction. Whatever the warfarin and heparin you see, okay, warfarin and heparin is used mainly, these are anticoagulant drug, okay, so these are also used in the prophylaxis of what, preventing this clot formation, atherosclerosis, okay, formation in the coronary arteries, okay. But among that, what is the primary drug, what is the primary drug of choice in preventing this myocardial infarction? Is that clopidogrel, is that the aspirin, is the warfarin or heparin you see? So among that, if you come, okay, yes, the aspirin is considered to be one of the important, a cornerstone in the MI prophylaxis. I can write here, okay. This aspirin is considered to be the gold standard in MI prophylaxis. MI prophylaxis. What it has to be done? What is the action of the aspirin? Aspirin is having an action of anti-platelet character. Sorry, it prevents the platelet aggregation. Prevents the platelet platelet aggregation. So whenever the platelets started aggregating in this coronary artery, okay, so there is a formation of the clot, okay. So this clot is going to hamper the blood flow in the coronary arteries, okay. So aspirin is to be considered as one of the gold standard drug in order to prevent the platelet aggregation. When the platelet aggregation is reduced, then ultimately there is a formation of flake or the atherosclerosis has been reduced. Okay, when the formation of the flake or atherosclerosis has been reduced, then ultimately we are going to prevent this myocardial infarction. Okay, then whatever the clopidogrel you see, this drug is mainly an anti-platelet drug. It is an anti-platelet drug, okay, or anti-platelet agent. So this drug is also been used in the prophylaxis, but not the first drug. Okay, it is also along with the aspirin, even the clopidogrel can be used as a co-drug or the supplementary drug in MI prophylaxis. The warfarin and heparin, as I told, so these drugs are mainly used as an anticoagulant drug, anticoagulant drug, okay. It is going to prevent the formation of the clot, it is going to prevent the formation of the clot, okay. So even the clot formation is also one of the important factor in myocardial infarction. So these drugs are going to act, but it is not a primary drug. Again, it is not a primary drug. Sometimes all of these drugs can be used in combination, okay. Aspirin, clopidogrel, or even the warfarin can be used in the combination in order to have a what, a prophylaxis in a high risk patient, prophylaxis for high risk patient. But when you are asked for an individual drug, okay, so the individual drug will be the aspirin. Aspirin is considered to be the most important and a very gold standard drug in preventing myocardial infarction or the drug for prophylaxis, okay. Let us see what other questions may ask, or what is the dose of this drug can be given as a prophylactic dose. Aspirin, you see many patients which comes with the cardiac history, okay, so there is a one ecosprin has been added to that. Why? It is a prophylactic dose. Clopidogrel or the atorvastatin is not most commonly used. They will check the cholesterol level, okay. Whether the patient requires the atorvastatin, the patient requires the clopidogrel, that they will see. But most of the patient prophylactically are going to use or add on the ecosprin or the aspirin, okay. So what is the dose of this aspirin for prophylaxis, you see, okay. So generally, normally what will be added, okay, 75 milligram of one ecosprin or the aspirin is added daily, okay. Daily one ecosprin or aspirin of 175 milligram has been added generally, It depends upon the risk of the patient. Okay, how uh, uh, risky that patient. Okay, so the dose may vary. Okay, if the patient immediately comes with the history of any myocardial infarction, okay, in such a condition the dose varies from 162 to 325 milligram. Up to this you can give. Okay, 152 to 325 milligram of ecosprin as an prophylactic dose, as an prophylactic dose can be given. Okay, so these are available in the tablet form. Okay, the patient, I will advise the patient to chew this tablet immediately. Okay, chewable chewable tablets will be given. What is the route of administration of these drugs? Of course you will give this through the oral route. Okay, route of the drug you see. So these drugs can be given orally. Okay, so when to give? Prophylactically, it will be given for a month together or years together. Okay, if already had a history of a myocardial infarction, for that patient also given. Okay, patient is having an general history of any cardiac diseases, for them also prophylactically for a longer duration of time this aspirin has been given. Okay, but when a patient comes with the history of recent history of myocardial infarction, okay, for them you see, when a patient comes complains that there is a chest pain, okay, maybe mimicking to the myocardial infarction, then immediately, okay, immediately this drug to be given immediately. Once you suspect that it is a infection, it is a myocardial infarction, immediately after suspected that the case is a mi, then immediately how to give the dose. What is the dose? The immediate loading dose. It is a loading dose. It is a loading dose. It is a maintenance dose. Is a maintenance dose. So the loading dose of 162 to 225 milligram of aspirin is given as a prophylactic dose once you suspect that the patient is now is having an myocardial infarction. Okay, so along with that, we are going to give some other two important drug as a prophylactic dose. Aspirin is the primary drug. Okay, so along with that, as I told, even we can give the what is that, clopidogrel is also given. Okay, grill is the another second drug to be added on to this prophylaxis of what, myocardial infarction. Okay, so doses of this clopidogrel, if you take a loading dose of about 300 to 600 milligram of a clopidogrel has been given as a loading dose. After giving a loading dose, we are going to give an maintenance dose, maintenance dose of this clopidogrel of 75 milligram daily. Okay, so as ecosprin is given 75, same similar way, even the clopidogrel is also given as an 75 milligram of tablet daily. It is given for the as a maintenance dose, as a maintenance dose. Then we are going to add on the another drug. Okay, there is a triple therapy we are going to give. There is a triple therapy in immediate prophylaxis of the mi. Okay, that is another one is statin. What is that statin? Atorvastatin. Atorvastatin can be given as a prophylactic for the prophylaxis of mi. What is the dose of this atorvastatin? You see, this dose is also given as a loading dose. Okay, so loading dose, how much you will give? We are going to give an 80 milligram of atorvastatin is given immediately. 18 milligram as a loading dose and a maintenance dose of 10 to 20 milligram. 10 to 20 milligram of atorvastatin has been given as a maintenance dose in the treatment of prophylaxis for the MI. Okay, very, very, very important MCQ I can mention here. Okay, very, very important. Very, very important. So many time, frequently the questions has been asked from this area. What is the prophylaxis for myocardial infarction at the high risk patient? Okay, aspirin is the primary drug. Okay, it is a primary drug. Clopidogrel is also one of the choice of drug. Okay, even the statins like atorvastatin is also used. Warfarin and heparin, if you see, okay, so these are used. Sometimes they will used in the combination of aspirin, used with the combination of an aspirin, but the risk is there. What risk? There is a risk of bleeding. Okay, because of this risk, okay, so less commonly it is used as an prophylactic dose. Okay, or else it is used in the thrombolytic therapy. Whenever the patient undergoes for a thrombolytic therapy, okay, then we can use this warfarin and heparin there after thrombolytic therapy. Okay, just to reduce the clot formation. Okay, just to avoid the clot formation, some anticoagulants like warfarin and heparin has been given. Okay, I hope it is clear. A very important MCQ. Now we will move on to the another MCQ, that is, what is the drug of choice for reducing increased intracranial pressure? What is the drug of choice in reducing ICP, intracranial pressure? What happens? This we have discussed already. Okay, where there is an excessive collection of the fluid in the cerebral tissues. Okay, which causes the cerebral edema, increases the intracranial pressure. So what we have to do? Read out the options carefully. Furosemide, mannitol 20%, dexamethasone, and hypertonic saline. Hypertonic saline. What is the drug of choice? Does the furosemide can be used in the treatment of reducing the intracranial pressure? Always keep remember, okay, furosemide, generally what we can call as an elastics, is used as a drug of choice in relieving the excessive fluid collection in the cavities most commonly. Okay, or generalized edema. In order to treat the generalized edema, okay, even the extracellular fluid, interstitial fluid, okay, interstitial fluid is being usually extracted or taken out by the administration of the furosemide. But the furosemide is not always a choice of drug in treating the intracranial pressure or the fluid collected in the intracranial cavity, or that is cerebral edema. For the cerebral edema, it is not the most common choice of drug. Okay, so it is not a choice of drug. Does the mannitol can be used? When we were discussing about the diuretic, I told, okay, mannitol is been used in the treatment of treating ICP. Yes, this is used. Is the dexamethasone is also been used? May be used. Okay, then what about the hypertonic solution? Yes, even hypertonic solution can also be used as a drug of choice in treating ICP, intracranial pressure. But among that, which is most common drug? What is the most common drug in treating the intracranial pressure? You see, the most common drug will be the furosemide. I told, generalized edema, edema of the cavities like a pleural effusion if you take. Okay, the other edemas if you take. Okay, in order to reduce that, furosemide or lasix is generally used. Okay, but when you come to the a cerebral cavity, okay, there, in order to reduce the cerebral edema, okay, always you are going to choose a drug. What is that? Mannitol. Mannitol, 20% of the mannitol is considered as the first line drug. Mannitol is the first line drug for increased intracranial pressure. Okay, mainly it is going to reduce. It is the first line drug for treating the intracranial pressure. What is that drug? This mannitol. Mannitol is an osmotic diuretic. Osmotic diuretics. Okay, it is highly lipid soluble, easily pass the like blood brain barrier, and which helps to extract the excessive fluid which is collected from in the cerebral tissues. Okay, hence the mannitol is one of the best choice of drug to pull out the fluid from the brain tissue. Next to that, if the mannitol is not available, okay, so hypertonic saline can be used. Now this drug is used as an alternative drug, alternative drug in treating or reducing the ICP. Okay, hypertonic saline is used as an alternative drug if the mannitol is not available. Okay, then what about the dexamethasone? Does that dexamethasone helps? Sometimes even furosemide is also going to help, but as I told, when a mannitol is there, that is furosemide is not a choice of drug. Okay, furosemide is used as an adjunctive drug in treating the ICP as well. Okay, but to come to the dexamethasone, so dexamethasone, it mainly helps to avoid the complications of the increased intracranial pressure. Okay, whenever there is an increased intracranial pressure, there is a tensity on the nerves as well. Okay, so nerve cell membrane get disturbed, then there will be a possibility of developing the seizures. There is a possibility of developing the seizures. Then what the dexamethasone does? This dexamethasone is mainly going to stabilize the dexamethasone is going to stabilize the neural membrane, neural membrane. Okay, by doing that, what it does, it prevents seizures, it prevent seizures mainly. Okay, so it may be help, it is maybe directly not helping in relieving the intracranial pressure. It does helps in avoiding the complications which are associated with the increased intracranial pressure. Well, next we will move on to the another drug, sorry, another MCQ, that is, what is the drug of choice for preventing and treating eclampsia? Most a very important condition in the CNS system. We have discussed in detail regarding this. Okay, when you are discussing the drugs on CNS or anticonvulsant drugs, in detail we have discussed. What is the drug of choice for preventing and treating eclampsia? There are two conditions are there. Please carefully read out. One is that drug can be used in preventing the eclampsia, and also the drug is also to be used in the treatment of the eclampsia as well. Okay, read out the options. Diazepam, diazepam can be used. Does the diazepam helps in treating the eclampsia? Maybe yes, but does is a drug of choice? Let us see. Magnesium sulfate can be used in the treatment of eclampsia. Yes, of course. The magnesium sulfate can be used in the treatment of eclampsia. Phenytoin, what is the action of the phenytoin? It's an anti-epileptic drug. Okay, it is going to prevent the seizure attacks. Seizure attacks. This does the phenytoin is also been used? Yes, it is also one of the important anti-epileptic drug can be used. Labetalol. Labetalol is a generally a anti-hypertensive drug. Okay, what happens to the eclampsia? The eclampsia develops in a pregnant woman. Okay, whenever there is an increase in the blood pressure, okay, the associated increased blood pressure among the pregnant woman may resulting into development of seizures, that is called as an eclampsia. Okay, so someone even sometime, yes, even the labetalol may helps in treating the eclampsia, means the hypertension associated with the eclampsia, but not the first choice, not the first choice. Okay, we have eliminated the labetalol. Diazepam, diazepam again, it is not the first choice. Just we have eliminated these two. Now the two important anti-epileptic drugs are there. One is the phenytoin, another one is the magnesium sulfate. So among that, what is the most common drug or the drug of choice that should prevent and that should treat the eclampsia? If you come to the phenytoin, okay, of course it is a very good drug of a anti-epileptic drug, but there is a possibility, okay, there is a possibility of recurrence of seizure attack. Recurrence of seizure attack. Penantine is going to treat the means treat the seizures, but what is there? There is a possibility of having a recurrence of the seizures. Possibility of recurrent seizure attack may come. Hence, then it is not going to prevent. It is only just treating the eclampsia. It is not preventing the eclampsia. Then phenytoin is also not maybe your option. Okay. Then what is your right option? The right option for treating the eclampsia and by preventing the eclampsia, your answer will be the magnesium sulfate. Magnesium sulfate generally is called as MgSO4 is the drug of choice in treating the eclampsia. Drug of choice in treating the eclampsia. Okay. What the diazepam does? Diazepam is considered to be the second choice drug. Second choice drug if the magnesium sulfate is not available or it is contraindicated. Okay. How much to give? What may be the dose? Suppose if you want to give the diazepam in order to prevent the eclamptic seizures. Okay. So the dose you see, the dose of the diazepam may be 5 to 10 milligram. Slowly you have to give IV. Okay. Not directly you have to push, no bolus dose. Okay. Over 2 to 5 minutes of time. So even the diazepam helps in treating the eclampsia. So mainly it is uh, diazepam and lorazepam where we are going to use where in pediatric cases of an eclampsia. Okay. Pediatric, sorry, not eclampsia, sorry, Pedi- um, pediatric seizures. Okay. In order to treat the neonatal seizures. Okay. Where we are going to use the diazepam and lorazepam. But even in the adult also it can be used if magnesium sulfate is not available, or it is contraindicated. If you want to give the diazepam, 5 to 10 milligrams slowly IV have to be given over a 2 to 5 minutes of time. Does phenytoin can be used? Yes, even you can use the phenytoin. Okay. You can use the phenytoin as well. It is also a second choice of drug. Second choice of drug when the magnesium sulfate is not available or it is contraindicated. It is contraindicated. But the what will be there? There is a risk. Okay. There is a possibility rather than the risk. I would like to say possible chances chances of recurrence of seizure attacks. It is not going to prevent, just it is going to treat. Just it is going to treat the seizures. Okay. Then the another option which is left is the labetalol. Does the labetalol can be used? You can use the labetalol whenever. Okay. When it will be used or when it will be effective, you see, it is effective. It is effective in managing in in managing acute seizure attack, acute seizure, acute seizure associated with the hypertension, associated with the hypertension in eclampsia. Patient is having a very high blood pressure and also the patient is exhibiting the symptoms of the seizure attack. Okay. Blood pressure is also high and exhibiting the attack of seizure, then you can use the labetalol. But always the best choice of the drug will be the magnesium sulfate. Always the first line or the best first choice of the drug will be the magnesium sulfate. Okay. Then next we will move on to the another drug, another MCQ, that is what is the first line drug class for symptomatic heart failure with a reduced ejection fraction. What is the, read out the question, what is the first line drug, first line drug class for symptomatic heart failure? Patient is exhibiting the symptoms for the heart failure, and also with the, there is a reduction in the ejection fraction. There is a reduction in the ejection fraction. Then what is the first line drug for that? Look at the options: digoxin, ACE inhibitors, loop diuretics, and calcium channel blockers. Calcium channel blockers. What is the action of the digoxin? The dose digoxin is used in the heart failure. Yes, does the digoxin is used in the heart failure. What is the action of the digoxin? Digoxin is a positive inotropic drug. Yes, it is a positive inotropic drug. Inotropic drug. Then what the inotropic drugs does? The major mechanism of the inotropic drugs is to increase the contractility of the heart. Contractility of the heart. Now, patient is exhibiting symptomatic heart failure symptoms with the reduction in the ejection fraction. Reduction in the ejection fraction. Okay. So it increases the contractility. Okay. And it is decreasing the heart rate. It is decreasing the heart rate. Does it helps in the treatment of a symptomatic heart failure? Maybe. But is a first line drug? You will check out. Next, come to the ACE inhibitors. All pril drugs. Okay. Enalapril, Catalapril. Okay. So those all the drugs are comes under the ACE inhibitors. These drugs helps in treating the heart failure. Maybe the yes. Okay. How it does, you will see. What about the loop diuretic? Loop diuretics. Diuretics mainly helps in relieving or reducing the excessive fluid collection. Okay, it is going to make the excessive fluid to be excreted out of the body, reduce the edema. Okay, so the does loop diuretic also helps in symptomatic heart failure. The reduced ejection fraction not maybe so good. Okay, if the patient is having a history of an edema, okay, so that may be the cause of a heart failure. Maybe it helps. Okay, but not the first choice of drug. Then calcium channel blockers. Calcium channel blockers and the other like a beta blockers and all. Okay, maybe these are supportive drug, or maybe these are adjunctive drug or supportive drug. Supportive drug. It is also maybe the loop diuretic is also a supportive drug, but not directly helps to improve the ejection fraction and to treat the symptomatic heart failure. Okay, in order to improve the ejection fraction, okay, what we have to do? We have to reduce the afterload. Okay, and you have to make some remolding in the heart. Okay, so for that, the best choice of drug or the drug which helps in that will be the ACE inhibitors. The drug of choice mainly in a patient with the symptomatic heart failure with the reduced ejection fraction, ACE inhibitors are going to helps more and used as a first line drug. First line drug. First line drug mainly for heart failure with what? There is a decrease in the ejection fraction. There is a reduced ejection fraction. This ACE inhibitors are going to helps by reducing the afterload. By reducing the afterload. Digoxin mainly it controls the what? Rate control of the heart, contractility of the heart is being regulated with the digoxin, but you need AC inhibitors to improve that ejection fraction, okay, reduce the afterload, okay, and improve the conditions of heart failure. Your option or the right answer will be the ACE inhibitors. Calcium channel blockers, beta blockers, these are all help are used as an adjunctive or a supportive drug to improve the cardiac output, okay, but here the choice of drug will be the ACE inhibitors. Now move on to the another question, that is, what is the drug of choice for nocturnal aneurysm in children? What is the drug of choice in nocturnal aneurysm? What is meant by nocturnal aneurysm? It is an involuntary passing of urine or bedwetting, what we can call. Okay, what is called nocturnal aneurysm is generally known or called as an bedwetting. The child is going to pass the urine in the bed itself without his consciousness, involuntarily, okay, unconsciously the patient has passed, sorry, the child has passed the urine in the bed, okay. That is one of the uh, maybe a behavioral disorder, or maybe the other causes, maybe the neuronal conditions may also cause this nocturnal aneurysm, okay, because the child is not having a control over the bladder sphincters, okay, so that is also going to cause or one of the reason for this nocturnal aneurysm. Behavioral changes, okay, are also the one some important causes for this nocturnal aneurysm. So what is the drug of choice? See, read out the options: oxybutynin, desmopressin, imipramine, and amitriptyline are the four options has been given. If you know the action of each individual drug, then you can choose the drug of choice. What about the oxybutynin? Do you know what is the action of oxybutynin? What action it does? This drug is mainly act as an antispasmodic drug. Antispasmodic drug. So when it is an antispasmodic drug, antispasmodic drug, okay. Yes, it is antispasmodic drug. What it does? It is going to control the contractility, okay, of the bladder. Mainly it is used, okay, mainly it is used for controlling bladder, controlling bladder. There is a condition called, okay, OAB. There is a condition called OAB, that is overactive bladder. Overactive bladder. So the bladder responds even to a minor filling, okay, so it overact, then it is also one of the reason of having a aneurysm, okay, nocturnal aneurysm. Maybe if it is found that this nocturnal aneurysm is mainly because of this overactive bladder, oxybutynin can be used, okay, but let us see the other options. Next is the desmopressin, okay. Desmopressin is always considered as the first preferential drug. First preferential drug. What it does? Okay, what it does? This a desmopressin is having an action. Okay, this action is similar to the ADH. Action similar to the similar to ADH, antidiuretic hormone. So what it does? What the antidiuretic hormone does? Mainly it reduces the production of urine, okay. It's an antidiuretic hormone, okay. So this desmopressin is similar action to the ADH, okay. It preferably makes a less urine, that too particularly during the night when the desmopressin has given before the child is going to a bed, okay. It preferentially produce less urine. When the preferentially less urine is been produced, then there is a less preferential chance of passing urine in the bed, okay. Hence the desmopressin is considered as the first preferential drug in this treating the nocturnal aneurysms. Then you come to the imipramine, as well as the amitriptyline. Okay, so both of these drugs, okay, both of these drugs are antidepressants, antidepressant drugs, tricyclic antidepressant. Mainly these are tricyclic antidepressant drugs. So these drugs are also have its action. Okay, CNS uh, suppression it is going to do. Okay, by suppressing that, it maybe sometime helps to reduce the this nocturnal aneurysms are involuntary passing of the urine in the bed. Okay, so these drugs can be used as an alternative drug, alternative drug of choice, drug of choice in the treatment of aneurysms. But the best drug or the first preferential drug in treating the nocturnal aneurysms will be the desmopressin. Mainly, it is mimicking the action of the antidiuretic hormone. It itself is going to reduce the production of urine and preferably reduce the passing of urine during the night time. Okay, even azobutin is also going to help. Imipramine and amitriptyline, all the drugs are helping in treating the nocturnal aneurysms. But the first preferential drug will be the desmopressin. First preferential drug will be the desmopressin. Mainly, it helps in lesser production of the urine, especially during the night. And if the less urine is been formed, okay, then there is a less possibility of passing the urine. If the condition is associated with the OAB, overactive bladder condition is there, then now the oxybutynin is the drug. Okay, so please see, you can mark it is also one of the important point. Okay, the question may come, what is the drug of choice for overactive bladder? Okay, now if the question comes that the drug of choice for the overactive bladder, then oxybutynin is the drug of choice. If the drug of choice for the nocturnal aneurysms, desmopressin. Desmopressin. If the desmopressin is not available or it is contraindicated, then the next choice will be the any anticyclic uh, antidepressant drugs. Tricyclic antidepressant drugs like as an imipramine or amitriptyline can be used as a alternative drug for nocturnal aneurysms. Now we'll move on to the another MCQ. What is the drug of choice for mania in bipolar mood disorder? Bipolar disorder. Bipolar disorder is associated with severe manic and a depressive state, or both. It goes periodically. Okay, a period of time the patient is manic, a period of time the patient will be depression or having a depression. That how to treat both mania as well as depression. Read out the options: lithium, valproate, haloperidol, and sertraline. These are the options. Okay, if you know an individual action of the drug, then you can answer this question. Lithium, what is the action of the lithium? It is a mood stabilizer. It is a mood stabilizer drug. What you need in the treatment of bipolar, you have to stabilize the mood because it is a mood disorder. Both mania and depression, both are the mood disorder. Okay, that you have to stabilize the mood. Then lithium works. Yes, lithium works. It is maybe the drug of choice. What about the valproate? What about the valproate? Valproate is one of the drug. Mainly, it is used in the treatment of mania. Maybe this drug is good for mania. Good for mania, not for depression. Not for depression. So we need a drug that to treat both mania as well as depression. Then valproate may not be the drug of choice. Valproate may be added, but it is not the choice of drug. Then haloperidol. Haloperidol is an antipsychotic drug. Antipsychotic drug. Okay. Mainly this haloperidol used in the treatment of what? In case of schizophrenia, in the treatment of this haloperidol is mainly used in the treatment of schizophrenia. Okay. So even the haloperidol may not be a good choice of drug in treating mania and depression. May be added, but again, it is not a choice of drug. Haloperidol is an antipsychotic drug, may be the choice of drug in schizophrenia. Okay. Sertraline is the drug with having a characteristics of an antidepressant. Is an antidepressant drug. So may not be good for mania. It may not be a good drug for mania. Okay. So we need a drug that should stabilize both mania as well as the depression. Okay. Valproate, I told valproate is good for mania. Haloperidol is antipsychotic drug. Okay, may be helpful but mainly used in the schizophrenia. Okay, then sertraline is the drug used as an antidepressant. Maybe may not be good for, not good for mania, not good for mania. Okay, then of course, then what will be your answer? Your answer will be the lithium, because this lithium, it helps to treat the mania as well as it helps in treating the depression as well. Okay, so that always you consider the lithium. I will write here. Okay, Li- lithium is considered to be, okay, considered to be a gold standard drug. Gold standard drug. Okay, gold standard drug in managing bipolar disorder. Bipolar disorders. Disorders, please keep in our mind, you can mark it as an important. Okay, lithium is considered to be a first line, okay, gold standard as well as first line drug. First line drug for managing the mood or bipolar mood disorders. Okay, which is stabilizing the mood mainly by a neurotransmitter modulations. Okay, valproate and other antipsychotics may be, okay, I'm not saying that these drugs are not used, may be used as an alternative drugs. Alternative alternative drugs, or as a supportive drugs, these drugs can be used, but always the first choice of drug will be the lithium. Lithium is the gold standard drug in managing bipolar mood disorders. Okay, hopefully it is clear. Again, it is a very very important question. Many a time this question has been come on this. Okay, lithium, a gold standard drug in managing mood disorders, even particularly for the mania is also a drug of choice, and for the bipolar mood disorder also it is a drug of choice. We'll move on to another MCQ. What is the drug of choice for tics in Tourette syndrome? What is that Tourette syndrome, or what is meant by tics? You see, okay. So what is meant by that? Tics is one of the what? One of the a neurodevelopmental disorder. One of the neurodevelopmental disorder. It is mainly characterized by, what are the characters you can find? There is an involuntary movements. Okay, and also there is an involuntary speak as well. Okay, there is an involuntary repetitive, not only involuntary it is, okay, involuntary and repetitive. Involuntary and repetitive actions or sounds. If the patient is keep on doing the same action for a continued time repetitively, involuntarily, and even he or she is going to be produce a repetitive sound. Okay, involuntarily and very repetitively, these things will be done. Okay, it is Tourette syndrome is one of the type of tics. Okay, it will be found especially among the pediatric age group. Okay, even in the adult also you can see this. So what is the drug of choice for tics? Okay, what is the drug of choice? Now look at the options. Clonidine is there, haloperidol is there, risperidone as well as methylphenidate. Methylphenidate are the options which is left here. So what may be the choice of drug you see? Clonidine is used as one of the what drug of choice in treating the ticks. Okay, but this clonidine is used in the mild cases. These drugs can be used in the mild cases. Clonidine is used, yes, of course it is used, okay, but it's used in the mild cases. Haloperidol is used, yes, of course the haloperidol is used in the treatment of ticks. Okay, then the risperidone is also going to be used, yes, it is also used in the treatment of this ticks. And even the methylphenidate, it is one of the CNS stimulant. Okay, is one of the CNS stimulant. It is mainly used, this methylphenidate is mainly used in the treatment of ADHD. ADHD, attention attention deficit hyperactivity disorder. Okay, so mainly it is used in this. So what is the management in this? What happens here, you see? Okay, mainly it may be due to a neuromuscular developmental delay. Okay, where maybe the uh, important neurotransmitters like dopamine, okay, or norepinephrine, if you see, so there will be a reduction in the functioning of those important neurotransmitters in the body, may resulting into development of either the ADHD or some of the important neuromotor disorders like a tics. Okay, so methylphenidate can be used as an alternative drug, but it is the first choice of drug for the ADH. Okay, clonidine is used, it is also can be used, but it cannot be used for a what moderate to severe cases. It cannot be used, it can be used for the mild cases. Now two left, haloperidol and risperidone. Okay, so haloperidol is, I will always having a superior, okay, it is a superior antipsychotic action. It is having antipsychotic action against the ticks compared to the risperidone. Risperidone can be used, okay, but haloperidol is having a superior action than the risperidone in the antipsychotic action against the ticks. Mainly, it is going to block the dopamine receptor. I can write here, okay, how this haloperidol act, okay. What you have to make, dopamine is one of the important neurotransmitter which is mainly involving in this. Okay, so what it's supposed to do, it has to decrease the dopamine action. Okay, it has to reduce the dopamine action. How the dopamine action is being reduced? This haloperidol is going to reduce the dopamine receptor activity. Dopamine receptor activity, when the dopamine receptors are get inhibited, okay, then there is a decreased action of the dopamine. When the dopamine is being reduced, then ultimately there is a reduction in the tics. Okay, so haloperidol is considered to be a little superior compared to this risperidone. Okay, if the risperidone is if the haloperidol is not available, okay, now this risperidone can be used as a second choice of drug. It can be used as a second choice of drug in managing these attacks. Okay, very important thing to remember, the important neurotransmitter involved here is the dopamine. We have to reduce the dopamine, then ultimately we are going to reduce the a involuntary action, involuntary sound which are related to the tics. Clear? Okay, so important question from the CNS. Now, what is the drug of choice for uncomplicated typhoid fever? What is the drug of choice for uncomplicated typhoid fever? So what is meant by typhoid fever? So what is, say, read out the question carefully. The drug of choice for uncomplicated, okay, it is not a complicated typhoid fever, uncomplicated typhoid fever. Let us first, before going to the discussion on the options, what is the causative organism for the typhoid fever? what is the causative organism for the typhoid fever? Maybe that may be the question. Okay, maybe the question will come from the typhoid fever. What is the causative organism? The typhoid fever is caused by salmonella salmonella typhi. What is the causative organism? Salmonella typhi is the a causative organism for the typhoid fever. So what is the drug of choice? Ampicillin, ciprofloxacin, chloramphenicol, and azithromycin. So four different type of antimicrobial agents are being used. Of course, you need antimicrobial agent. Okay, it is one of the a microbe. Salmonella typhi is one of the a microbe. Okay, so in order to treat that a bacteria, okay, then we have to use any of the antimicrobial agent. So does the ampicillin work against that Salmonella typhi? Maybe. Okay, maybe. Ciprofloxacin, yes, maybe. Chloramphenicol, yes, maybe. Azithromycin, yes, maybe. Okay, so all of these four drugs may work against the Salmonella typhi. But what is the choice of drug? What is the choice of drug in treating this? Ampicillin, if you see, when we were discussing the antimicrobial agents, I have been told a single use of the ampicillin has now restricted. Why? We are not using ampicillin as a single dose. Why? Because many of the bacteria or many of the microbes has developed a developed a resistance to this ampicillin, and a single use of ampicillin is no use now. Single use of ampicillin is no use now. So because of that, we are not using the ampicillin. So though it may be effective against the Salmonella typhi, it is not our option because it is not effectively treat the Salmonella typhi, because the body has developed a resistance. If the body has developed a resistance, okay, the bacteria has developed a resistance, then it is not effective against the Salmonella typhi. Ciprofloxacin, if you see, okay, ciprofloxacin belongs to a class of fluoroquinolones. Okay, yes, this drug is active. Ciprofloxacin is active against the Salmonella typhi. This drug is active against the Salmonella typhi. Even the bio oral availability of this drug is also very good. Okay, so because of that, yes, ciprofloxacin can be given as a choice of drug. Then come to the chloramphenicol. Chloramphenicol we are using nowadays. Even the usage of the chloramphenicol is also reduced now. Why? Why again? You see, even there are many bacteria has again developed a resistance, has developed a resistance to this drug chloramphenicol. Hence, because the chloramphenicol is considered as an outdated drug nowadays to use as an independent drug for many then many microbes. Okay, so maybe the chloramphenicol is also not a good choice of drug. Azithromycin, yes, azithromycin is having a very good action against many microbes. Okay, but is the first choice of drug, you see. Okay, rather than that, azithromycin can be used, but this azithromycin is used as a good choice of drug or drug of choice in in resistant cases of typhoid fever. Typhoid fever. Okay, so directly we are not going to use azithromycin as the first choice of drug. Okay, if the a bacteria or the Salmonella typhi has developed an resistance to this ciprofloxacin. Okay, ciprofloxacin. Now you can use the azithromycin as a second drug, or in case of an resistance has been developed to the typhoid fever. Okay, then this azithromycin is used as a drug of choice. It is used as a drug of choice as the second drug. First choice of drug always will be the ciprofloxacin, because ciprofloxacin is very good and very active against the Salmonella typhi. So your answer will be the ciprofloxacin. Your answer will be the ciprofloxacin. Clear? Next, what is the drug of choice for uncomplicated vaginal candidiasis? Okay, what is the drug of choice for? See, read out the question carefully. Uncomplicated vaginal candidiasis. Okay, so it is by read out this question. Okay, we'll come to know that. Okay, it is a fungal infection affecting mainly the genital organ such as vagina. Okay, and the fungal infections may affect to any part of the body. Okay, here the question asked is on the vaginal candidiasis, and that too vaginal candidiasis is not complicated, is an uncomplicated vaginal candidiasis. What is the drug of choice? What is the drug of choice? We have option that is nystatin, clotrimazole, fluconazole, and meconazole. Okay, all zole drugs are antifungal drugs. Zole, zole, zole. Clotrimazole, fluconazole, or meconazole, all those are a antifungal drug. Okay, even nystatin is also a antifungal drug. Okay, it is also a antifungal drug. It can be used mainly. Okay, so this nystatin is mainly used for candida infection affecting mainly on the skin. Okay, body skin, mouth. Okay, and esophagus and GI tract. If this a candida infection on the skin, on the mouth, or on the esophagus, or on the GI tract, okay, so nystatin can be used as a choice of drug, but it is not a so good drug for the vaginal candidiasis. Then come to the clotrimazole. Now this is a good choice of drug. Okay, it is a good choice of drug used in the treatment of both oral as well as vaginal candidiasis. Okay, candidiasis. Well, next come to the fluconazole. Yes, it is also a good drug of choice in both the oral as well as vaginal candidiasis. Both can be used. Then come to the meconazole. Okay, so this meconazole is also used in the treatment of vaginal candidiasis, but these are available as vaginal suppositories. Vaginal suppositories. Okay, and it can be used for 7 days. These drugs, meconazole suppositories, can be used for 7 days. Okay, so now I have three options left. Cotrimazole is also used, fluconazole can be also used, as well as meconazole can be used. But among that, which is considered is to be the drug of choice? Fluconazole and cotrimazole, if you see, the cotrimazole especially. Okay, so this cotrimazole is used for local use, topical usage. I can write here cotrimazole. Okay, cotrimazole can be used for local or topical uses. Topical uses available in the form of like cream or ointment. Okay, available in such a form, so it can be used locally, and it used for many days. Used for used for many days, maybe a week. But if you take the fluconazole, Both are good choice of drug. Both are good choice of drug. Cotramazole is also a good choice of drug, as well as fluconazole is also a drug of choice in vaginal candidiasis. But the advantage of this fluconazole, you see, so this drug can be used as a single drug. Single dose of this drug can be used. Even if you take a one tablet of the fluconazole, okay, so that is going to produce or give the same effect of that cotramazole or meconazole, which has been given effect for 7 days. Okay, so then which is more convenient, whether the cotramazole or the meconazole or fluconazole? Meconazole, suppose it is available, that to be kept in the vagina, okay, that to be monitored properly, okay, and how to wait for days. Clotrimazole also can be used locally or topically, okay, how to wait for days. But fluconazole is having a advantage over both of these drugs. So what is the advantage? It is used as a single dose of drug. Okay, so what is the dosage? You see, if you take 150 milligram of a single tablet of fluconazole, okay, so that is going to give a similar effect of all other antifungal drug. Hence always the fluconazole stands at the first. Always the fluconazole is considered to be the first choice of drug in treating the vaginal candidiasis. Vaginal candidiasis. It does not mean that nystatin, clotramaxol or meconazole can be used. Other also an alternative drugs available, but comparatively the fluconazole, even a use of single dose of the fluconazole will give the same result of the other drug, which can be used for many days. Hence, fluconazole is considered, always it is considered as a drug of choice for vaginal as well as oral candidiasis. Okay, well, next we'll move on to another MCQ. What is the immediate drug of choice for acute myocardial infarction? What is the immediate drug of choice for acute myocardial infarction? Hopefully, you have discussed this in detail already in the previous question. You might be knowing. Okay, does the heparin is an immediate drug? Heparin, what it does is an anticoagulant drug. So, does it helps to treat the acute myocardial immediately? It is helps. It may not be. Aspirin, it is an antiplatelet. It is going to prevent the platelet aggregation. So what is important thing to understand in the myocardial infarction? Patient already had developed a myocardial infarction. Okay, so further condition of the myocardial infarction should not deteriorate. Then in order to avoid that deterioration of the infarction, what we have to do? We have to prevent the further aggregation of the platelet. The further aggregation of the platelet prevented, there is a prevention of the clot. Okay, then always the aspirin stands at the first. Aspirin considered to be the always the first choice of drug or the immediate choice of drug in acute myocardial infarction. Acute myocardial infarction. Then what the streptokinase does? It is used as a thrombolytic drug. Thrombolytic drug. Once the patient has developed an myocardial infarction, you come to know that there is a clot formation. In order to remove that clot, okay, what we are going to do? We are going to give a drug such as streptokinase, which what it crush that clot. Okay, the clot is to be removed and later it will be treated the myocardial infarction, but not the immediate drug of choice. First you have to prevent the further aggregation of the platelet, prevention of the further clot formation. So aspirin is given to be the first choice of drug. What about the clopidogrel? I told it is also a antiplatelet drug. Okay, but aspirin is more superior than the clopidogrel. Hence, always you consider the first drug of choice will be the aspirin. Always the first choice of drug in the acute myocardial infarction will be the aspirin is considered to be the first drug of choice, and which is going to prevent the further further platelet aggregation. Platelet aggregation. That is the most important thing you have to remember. What is the other management of this acute myocardial infarction? Maybe the question will come. Okay, what is the other management? Other management, I can, instead of other management, I just would like to write again management of acute mi. I think already in the medical surgical in detail you have discussed about this. Okay, just I would like to give some brief on this. Okay, so what is the management of the acute mi? Mainly we are going to use monotherapy in treating this. Yes or no? Mona B. Mona B treatment is usually used in the treatment of acute myocardial infarction. Immediately, if the patient suspected that he is having a myocardial infarction, aspirin will be given. What is the dose I told? The dose is 162 to 325 milligram. 325 milligram of aspirin can be given. 325 milligram of aspirin can be given. Okay, how much? 300 to 600 milligram of clopidogrel. This is aspirin. Okay, and 80 milligram of atorva. Atorvastatin can be given as a immediate prophylactic dose. Okay, then later you will manage this myocardial infarction, acute myocardial infarction, by monotherapy. Okay, where the M refers to morphine, where it is helps in relieving the pain associated with the myocardial infarction. O refers to the oxygen therapy or oxygen administration. Okay, where N refers to the nitroglycerin. It helps in nitroglycerin. It mainly helps in dilating the coronary blood vessels and improving the oxygen supply to the myocardial cells. Okay, and aspirin is used as a maintenance dose. Aspirin is used as an maintenance dose. Okay, and where the B refers to the beta blocker. Mainly this beta blocker, what it does, why the beta blocker is added in that? Okay, these beta blockers are going to prevent the further complications, prevent further complications related to the MI, further complications related to the post MI. I can write here post MI, post MI. Okay, so this may be the management of what? Uh, Acute myocardial infarction. Well, another 2 3 MCQs are left. Okay, just another 10 minutes you give me. Okay, next, what is the drug of choice for mass drug administration in lymphatic filariasis? Okay, is also a national program is running under this to prevent the filariasis. Okay, in some areas it is more prevalent now. It may be the endemic. Okay, so mass drug administration will be done in order to prevent this lymphatic filariasis. Lymphatic filariasis. Okay, so what is the drug of choice for mass drug administration? Single drug is different. Okay, mass in the sense to a generalized public in a certain areas where there is a what this filariasis is prevalent and more cases has been found. Okay, so in such a cases, what may be the drug of choice means what may be the drug used as a mass drug to the whole area? Here we have option, that is ivermectin, albendazole, DEC, diethyl carbamazine, and praziquantal. Praziquantal is the another drug. So all of these drugs are antipyretic drug. Okay, they work against the micropilaria as well as the lymphatic pilars. Okay, so when you are administering in the mass, so which drug is been used as this? So you might have heard about this ivermectin. What is the action of the ivermectin? Why the ivermectin is used? It is also having an action of antipyleric effect, antipyleric action the ivermectin is having. Albendazole is also used. Yes, it is also used in the treatment of a mass filariasis. DEC, yes, of course, the DEC is also been used in the treatment of what? The mass filariasis. And if you take this praziquantal, it is an actually an anti-helminthic drug. Okay, it is mainly used in the treatment of tapeworm, worm infections, tapeworm infections. Okay, or sometimes it is used in the treatment of flukes also. Okay, fluke formations, there also this praziquantal is been used as a anti-worm drug or anti-helminthic drug. It is not the most common drug used in the filariasis. So the most common drug you see, okay, the mass for a mass administration, the most commonly you are going to use DEC. What is that? Diethyl carbamazepine is used. Okay, so this drug is used as the mass drug for treating the filariasis. What is the advantage of using this drug? You see, even it kills. Okay, even it kills the microfilarias also. Kills microfilarias or larvae is what you can call. Okay, a small, a newly budding a filarias or larvae are also by killed by this DEC, and this DEC tablets are distributed in a mass. Okay, distributed in a mass. Okay, when they have asked about the individual drug, okay, when they have asked about the individual drug, DC is the first choice of drug in mass administration for lymphatic filariasis. Sometime, okay, there is a alternative regimen is also available in treating the this lymphatic filariasis. Okay, so the regimen for treating this, you see, regimen for treatment of filariasis as a single drug. As a single drug, what we are going to use? For the single drug, we are going to use the DEC, diethyl carbamazine is the drug used as a single drug. If you are using a single drug, sometime rather than using a single drug, it is better to use the double drug or triple drug therapy. Double drug or triple drug therapy. There is a double drug therapy, and there is another option or the another regimen available is triple drug therapy. So what included in the double drug, you see? In this double drug therapy, there are two drugs are included in that. Okay, one is the most common will be the DC, diethyl carbamazine. Okay, so along with that, the albendazole has been added to this. Okay, along with that, the albendazole is added to this. Okay, so adding up this albendazole mainly helps in transmission of the this filaria among the other people. Okay, so albendazole helps in preventing better prevention of this filariasis. Okay, rather than giving a DEC single, albendazole is added give a better effect. In some cases, okay, where there is more prevalent areas of this filariasis, okay, they are going to use the triple therapy. What is that? Most commonly we are going to use the DEC. Okay, so along with that, there is a addition of ivermectin. There is an addition of ivermectin, and also there is a addition of albendazole is also been used. Albendazole is also been used in the triple therapy, which gives the complete protection, which gives an complete protection against this lymphatic filariasis. Okay, so it is usually like given in areas where there is a more pandemic of this filariasis. If you come to the dose of this, okay, DEC, diethyl carbamazine, is given as a 6 milligram per kg. Ivermectin given at the dose of 200 microgram per kg, and albendazole albend albendazole, you know that there is a single dosage of albendazole will be given as an 400 milligram. 400 milligram. the combination of this can be used. But where we are going to add this ivermectin or in the triple therapy you see, so it is most commonly used, okay, where there is a more prevalence used in area with with ankylosis. Ankylosis, it means, it refers to an river blindness, river river blindness, liver blindness. Okay, so wherever there is a more prevalence of this onchocerciasis, okay, so in such areas where there is an addition of ivermectin has been done, okay, so that helps more to treat them this lymphatic filariasis. Maybe question may come, please do remember, if there is a single drug, the DC is the choice of drug in the mass distribution. If you want to go for a double therapy, okay, so both DC as well as the albendazole can be used, and in the triple therapy, DC plus ivermectin can be used as a triple therapy. Next, you come to the, what is the first, next MCQ, what is the first line drug for attention deficit hyperactivity disorder? Just now I have seen one previous question, that is nocturnal aneurysm. It is a similar another question. ADHD is one of the a behavioral disorder of the pediatric group. Okay, so what is the first line drug for attention deficit hyperactivity disorder? Options you see: atomoxetine, guanfacine, methylphenidate, and bupropion. Bupropion. Let us see this. If you know the action of each individual drug, you can answer this question. What is this atomoxetine act? What is the action of this atomoxetine? This drug is used as a non-stimulant drug. It is a non-stimulant drug. Non-stimulant, and norepinephrine, norepinephrine reuptake, norepinephrine reuptake inhibitor. The atomoxetine, it is a non-stimulant. It is not going to stimulate the CNS. Rather, what it does, it is going to prevent the norepinephrine reuptake, because norepinephrine and serotonin are the two important neurotransmitters which are essential for intellectual functions like attention, okay, the cognition, okay. So this, if there is an excessive epinephrine, there is an excessive dopamine, there is an excessive serotonin, okay, so all these neurotransmitters usually associated, excessive production or excessive utilization of those neurotransmitter may cause these conditions like an ADHD. So what you have to do, you have to prevent, or you have to inhibit the reutilization or reuptake of the norepinephrine. You know that, okay, so neurotransmitter, once it has been released in the presynaptic space, okay, so that will be reuptaken or it will be reutilized for the neurological function. Okay, so there are certain drugs which are going to prevent the reuptake of those. Okay, so among that, this atomoxetine is the one of the drug. It is going to inhibit the reuptake of norepinephrine. Then if you take the the guanfacine is also one of the a non-stimulant drug. Rather, it is not going to stimulate the CNS. If you take the bupropion, it is one of the antidepressant drug. One of the antidepressant drug. But if you take the methylphenidate, just now we have seen in the earlier MCQ discussion. So this drug is CNS stimulant. CNS stimulant. What it does, this drug is going to increase the norepinephrine, norepinephrine and the dopamine and the dopamine. So what happens in the ADHD, you have to understand the clinical features and the cause for this ADHD. So what happens here, so because of this decrease in neurotransmitters in the brain, okay, so the child focus is disturbed, the attention has been disturbed, and the child is involved in the other activities. That is what we told, that there is a deficit of attention and there is an hyperactivity. What you need more epinephrine and you need more dopamine to be involved. When the epinephrine and dopamine is been utilized by the brain, okay, then it mainly helps in some intellectual functions like attention and focus. So what this methyl penidate does, it directly stimulates the brain by increasing the increased epinephrine and dopamine. Okay, so always it is considered to be the first drug of choice. It is considered to be the first drug of choice in treating the ADHD. That in we have seen in the previous MCQ also. Okay, methylphenidate, desmopressin is for nocturnal neurosis and methylphenidate is the drug of choice for ADHD. It does not mean that the atomoxetine as well as the guanfacine is not used. So these are used as a non-stimulant. Okay, non-stimulant. And whenever if a child develops an dependency, because this drug is like some addictive drug, this drug is having a character of addictive character is there. Okay, so if the child started developing an addiction over this methyl penidate, okay, so you can use this as an alternative drug. Now you can use this alternative drug. I can write here, if child develops addiction or dependency for methyl phenidate, okay, can use can use alternative drugs such as, which are the drugs can be used, you can use the atomoxetine or guanfacine can be used as an alternative drug for treating ADHD. Okay, but the first choice of drug will be the methylphenidate. Methylphenidate. Clear? So the last MCQ that we are going to discuss today is the MCQ. So what is the drug of choice for preventing chemotherapy-induced nausea and vomiting? Chemotherapy-induced nausea and vomiting. So always you keep in your mind. So most of the chemotherapeutic drugs are induces the vomiting. Vomiting, nausea and vomiting is most prevalent when the patient is on the chemotherapy. Why? Because you see, so most of these drugs is usually surpass the CTZ center, that is chemotherapy trigger zone in the brain, and that stimulate the vomiting centers. By stimulating vomiting center, that is going to cause the chemotherapeutic induced nausea and vomiting is most common with the most of the chemotherapeutic drugs. Okay, so among that, which is the choice of drug in preventing chemotherapy induced nausea and vomiting? So when we were discussing about the GI drugs, I have told about this, but just let us see. Metoclopramide, it is also having an antiemetic action. Ondansetron, antiemetic action. Dexamethasone is mainly used for the other purpose as a steroid drug, but also having some effect on antiemetic. Okay, and aprepitant is also having one of the character or action of this antiemetic property. So metoclopramide can be used in the what chemotherapy induced nausea and vomiting? Yes, this can be used. Yes, this drug can be used, but the thing is that it is not the first choice of drug. Well, ondansetron, I told, yes, ondansetron is always the first choice of drug in treating the chemotherapy induced nausea and vomiting. Dexamethasone not maybe the first drug of choice, and aprepitant is also not the first choice of drug. Okay, it can be used but not as the first choice of drug. So what is the difference between that? Even this drug can also be used in the preventing nausea and vomiting, which is related to the chemotherapy induction. Okay, but among that, which is considered to be the most common or a high priority antiemetic drug? So metoclopramide can be used, okay, but this can be used in the conditions like there is an breakthrough vomiting, breakthrough chemotherapy induced vomiting, breakthrough chemotherapy induced nausea and vomiting. So what is meant by this? You see, what is meant by breakthrough chemotherapy induced nausea and vomiting? Initially, the patient may not be developing nausea and vomiting. Maybe the delayed nausea and vomiting will be there. Okay, sometimes the patient may develop, sometimes may not be developing. Okay, so in such a cases, this metoclopramide can be used as an drug of choice in breakthrough chemotherapy induced nausea and vomiting. Ondansetron always the drug of choice in chemotherapy induced nausea and vomiting. Please keep in your mind. And while discussing the JI drugs, I have told about this also. Okay, so ondansetron is always the first choice of drug in treating chemotherapy induced nausea and vomiting. Dexamethasone is can also be used as an adjunctive drug or a supportive drug, but not the used as used as supportive drug, not the first choice of drug. And you see the aprepitant, this also I have told whenever I am taking an AGI class. Okay, aprepitant is the drug can be used as an antiemetic drug when especially you see, so when there is an delayed complications, uh, rather than complication I can write delayed side effects of the drug, delayed side effects of chemotherapy, and if the nausea and vomiting is because of a delayed side effect of the chemotherapy, now that you can go as aprepitant is the alternative drug. If the ondansetron is not available, it is a contraindicated, then you can go for aprepitant is the drug of choice in delayed side effect of chemotherapy induced nausea and vomiting. Okay, so this is also most commonly this question has been asked. Okay, the drug of choice for treating chemotherapy induced nausea and vomiting. Two drugs are there. One is the ondansetron. If the ondansetron is not available, next alternative drug will be aprepitant. Okay, so metoclopramide can be used only when there is a breakthrough chemotherapy induced nausea and vomiting. Clear? So hopefully you have discussed some important MCQs based on this drug of choice. Okay. So in the last class I have given the list of drug of choice also. Please go through that. Okay, and that definitely will helps to solve your any questions in the mains exam. Okay. So see you with other MCQs in the upcoming videos. Okay. So till then you just take care and study well for your mains and get succeeded. Thank you. See you in the next video.